I'm Lisette Ludwig, and here are 5 things you didn't know about Botox. Hi, I'm Lisette Ludwig, an aesthetic nurse specialist in Los Angeles. I've been in the medical aesthetic space for the last 14 years. I absolutely love what I do, and I'm so passionate about helping my clients achieve their beauty goals with long-lasting results. The reason I wanted to create this video is because Botox is a very common procedure, so I wanted to answer the most frequently asked questions and misconceptions that people have about Botox and address a few other helpful tips to consider before you book your next Botox appointment or maybe even your first Botox appointment. First and foremost, what is Botox and what is Botox made of? I'm gonna really try to simplify this for you guys, but Botox is a wrinkle smoothing injectable that's made from botulinum type A, a protein molecule that's when injected, it blocks the signals from nerves to your muscles. Then this prevents the muscle from contracting and therefore improves the appearance of fine lines and wrinkles. Some people may not be aware of this, but Botox is actually a brand name, and most often people use this name Botox to reference other products. For example, Dysport, Xeomin, Jeuveau. For the purpose of this video, I'm going to reference Botox. If you're looking for a hard and fast rule about when you should start Botox, you might be disappointed because there really isn't one. Although some people like to start preventative Botox treatments, personally, I recommend waiting until you notice some fine lines or significant movement. I like to say a good rule of thumb is if you see a wrinkle starting to crease or etch in your skin, that might be a time you might want to make a Botox appointment. The best thing to do is consult, and I personally say an in-office consult is always best. On average, the glabella, which is the area right in between your brows, usually requires about 15 to 20 units. Your forehead muscles usually require about 6 to 12 units, and the crow's feet right around your eyes usually require about 8 to 10 units. Dosing should really be determined by your provider during a consultation. I personally prefer an in-person consultation. Technically, Botox should last you anywhere from 3 to 4 months, but if you're getting a lighter or a more conservative dose, then you might notice you're not getting the longevity out of the product. It might only last you 2 to 3 months. The most common areas to inject Botox are the glabellar lines, which is right in between the frown lines, the forehead wrinkles, and the crow's feet. However, we do use Botox off-label, and some typical areas are around the nose, which are considered the bunny lines, or other areas we like to treat, the lines around the lip, which we call the lip flip, the chin, and the neck lines. Lastly, Botox definitely falls into the maintenance category. I recommend using collagen-stimulating ingredients in your skincare routine like retinol, peptides, and of course a daily SPF. For even more tips on how to get that perfect glow, follow me on IG at LisetteLudwig_RN and subscribe to my newsletter by heading over to lisetteludwig.com. Bye!